All right, let's dive right in. If you're prepping for your nursing exams, you already know population health is a beast of a topic. So today, we're going to boil it all down to the absolute essentials, focusing on how you can really make a difference for vulnerable patients. Let's get started.
Have you ever found yourself wondering about this? I mean, you can have two people with the exact same diagnosis, yet one of them just has a much harder road to recovery. Well, the answer usually isn't in the diagnosis itself, it's buried deep in the world of population health. And really, this question is the why behind every single thing we're about to cover.
So to really understand that why, we have to start by defining the core of the problem, and that is health disparities.
So what does that actually mean? A healthcare disparity isn't just a random occurrence. It's a specific, measurable difference in the kind of care that different groups of people get. And this isn't some abstract concept. It has incredibly real consequences. We're talking more risk factors, less access to care, and tragically, higher rates of disease and death.
And when we talk about who is at risk, you can see the list is, well, it's incredibly broad. It's not just one group of people. Vulnerability can come from your income, your ethnicity, your health history, or your identity. This just goes to show that as a nurse, you're going to be interacting with patients facing these kinds of challenges every single day.
Okay, so it's one thing to know who is vulnerable, but for your exams and for your practice, you have to understand why this vulnerability is so important. So now, we're going to connect the dots. We're going to draw a direct line from these risk factors to specific diseases.
And here it is. Seriously, think of this table as your whiteboard map for the exam. On the left, you've got some of the biggest chronic diseases we face, and on the right, the risk factors that fuel them. And look at the overlap. Things like poor nutrition and smoking don't just cause one little problem. They set off a whole cascade of potential health disasters. This, right here, is the pathophysiology of disparity in action.
And, it's not just about chronic conditions. Think about infectious diseases. From the common flu to COVID-19 to STIs, they all hit these vulnerable groups way harder. Things like not having access to vaccines or living in crowded spaces. It can create the absolute perfect storm for an outbreak.
So you might be thinking, wow, this is a huge systemic problem. Where do I even begin? Well, you begin right here. Your single most powerful tool isn't a fancy machine, it's your ability to perform a smart, compassionate, and thorough assessment. This is where you can literally change the entire trajectory for a patient.
So, what's the game plan? First, you build trust. It's the foundation. Without it, absolutely nothing else matters. Second, you zero in on their main complaint. If someone comes in worried about a cough, you deal with the cough. It shows you're actually listening, and it makes them want to come back. Third, and this is a big one, you have to be self-aware. You have to recognize your own biases so they don't get in the way of providing great care. And finally, you think bigger. You plan holistically and connect them to resources, whether that's mental health support, a local food bank, or a translator.
Okay, enough theory. Let's make this real. We're going to take this approach and apply it to a quick scenario, using a tool just like you'd use in a real clinical setting. So picture this. You're doing an intake, and a military veteran mentions offhand that they've been feeling really anxious. That one little piece of information, their veteran status, should immediately set off a specific set of alarm bells in your nursing brain.
So, what's your next move? Right now, what are the big, must-ask topics that are popping into your head based on that one single clue? Because this is exactly how exam questions will make you think.
And here you go. This isn't just a random list of possibilities. These are well-known, documented health risks for this specific group. Your assessment can't be generic, it has to be tailored. You've got to screen for things like PTSD, TBI, substance use, and this is critical, suicide risk. These are the life or death questions.
And this is what that looks like in the real world. It's a direct, respectful question pulled right from a nursing assessment tool. You're not guessing. You're using an evidence-based method to uncover what's really going on. Just asking this one question can open the door to a conversation that can save a person's life. All right, let's pull it all together. We've gone over the what, the why, and the how. Now let's really lock in the absolute must-know takeaways for your exams, and, even more important, for your career.
Okay, first, stereotypes are dangerous. Yes, population data points point you in the right direction, but never forget that every single patient is an individual. Second, being culturally responsive isn't just a nice thing to do, it directly improves health outcomes. Third, the teach-back method. Guys, this is your superpower. Asking a patient to explain the plan back to you in their own words ensures they actually get it. It is probably the single most effective tool you have for making sure they're safe when they leave. And finally, never ever forget your legal duty as a mandated reporter.
You know, when it's all said and done, it comes down to this. The quality of your assessment can literally be the difference between a patient falling through the cracks or getting the care they so desperately need. It's a massive responsibility, for sure, but it is also your greatest power as a nurse. So the real question is, are you ready to use it?